My name is Bernhard Baune. I'm Professor of Psychiatry and Cato Chair and Head of the Department of Psychiatry at the University of Melbourne. I'm greeting you from the ECMP meeting 2018 in Barcelona, where I've talked about and given a presentation as part of a symposium on functional recovery and patient perspective on functional recovery in depression. In the next few slides, I will talk about some of the highlights on this particular topics, which we call this two sides of the same coin, because we need to see the whole picture of patient recovery. So restoring patient recovery and patient functioning is one of the key aspects really in the treatment of mental illness, and in particular in MDD, so a major depressive disorder. However, we found that a number of differences between the definition and perception of functional recovery between healthcare providers and patients do exist, and we would like to follow them up in more recent research with some deeper understanding of what these differences are and how they potentially could be overcome. So understanding the symptoms perceived from a patient perspective and a doctor's perspective, as well as the treatment goals related to the cause of the illness and to the treatment selection of illness, is very important for both doctors and patients. So the relevance of functional outcomes are obvious to everyone. So these relate to areas in the workplace. So very often patients with major depressive disorder have loss of productivity. They have inability to actually go to work and have loss of days of work, which contributes to the indirect burden of illness worldwide. And in addition, they are at work and have little or less productivity, is also having a significant burden economically, but also personally through that inability. And in addition to that, family and home life are areas which are highly relevant for every individual, for every person. And restoring outcomes in those areas, improving the ability of having social relationships, having the ability to interact with other people, to do things on a daily basis, and to live basically in a community is highly important for patients. So these are areas of functional relevance. However, these areas of functional relevance are often not primary targets in treatment of patients with major depressive disorder. And it's quite interesting to see some of the more recent research in that area, which highlights the differences of perception of what is expected from antidepressant treatment between doctors and patients. As you can see in these slides here, they're the top-ranked items and symptoms in areas which doctors think are important for treatment outcomes when it comes to antidepressant treatment. Same for patients. And the differences between these two groups are that for doctors, the more typical symptoms which define ICD or DSM-based criteria are in the top 6 items. Whereas if you compare that to patients, they very clearly think that other areas are more important than symptom reduction. And these areas include that their life is meaningful again. It includes that they enjoy life, that they're able to do things on a daily basis. So here we have a first indication already of differences in treatment priorities between doctors and patients. Now this has also been corroborated by other research by our colleague Zimmerman, who clearly indicates that patients want to improve from doctor's perspective in positive mood, achieving better mood, preventing relapse, for example, restoring functioning, improving quality of life, and minimizing side effects. These are all important, very important goals in the treatment of patients from a doctor's perspective. And they are supported by a number of different studies. On the other hand, if you look onto the right-hand side of this slide here, patients' goals are different, and these are symbolized by different activities around relationships, around social life, around improving intellectual capacity, for example, and also finding a job and doing things on a day-to-day basis at home, improving physical health as well. So we have a clear understanding that there are differences, and this has also been shown to be relevant for the remission state of patients. So this is some research which indicates that patients who have been rated as being remitted by a clinician rating scale and then were asked to self-rate them whether they see themselves in remission or not. So half of them saw them roughly being also in a self-rated fashion in remission, whereas the other half didn't think they were in remission despite the clinician rating in remission. Now, looking at those patients who were rated as being remitted from a doctor's perspective and those who also at the same time thought and self-rated them being in remission, those patients were the ones who had much better functional outcomes here, less functional impairment, they had better coping strategies and abilities, had a higher life satisfaction, better quality of life, better relationships, and also their work performance was better. So this highlights really that the perception by a patient on their remission status gives important additional information together with the clinician-rated assessment on these functional outcomes. So if we then look at the overall journey from improving syndromal recovery, so where there is response to treatment and also remission to treatment, we are on a journey really to achieve functional outcomes and functional recovery in the end for patients. But to achieve this goal, it is important to consider both the doctor's perspective and highlight also the patient perspective importantly, as we've seen in the last few slides. I would like to thank you for your attention and hope that the presented information is useful for your clinical practice. Thank you.